Hi guys, this is Dr. James from Vitamin Detox Secrets. Today I'd like to talk about how you can treat cystitis and bladder infections. So in detail, I'd like to talk about causes, risks, and possible treatments for cystitis and bladder infections. Cystitis is one of the most common female diseases. It is estimated that 10 to 20% of all women experience urinary tract discomfort at least once a year. Among women without a history of urinary tract infection, 37% will experience it at least once within 10 years. 2 to 4% of healthy women also have an increase in bacteria in the urine. This is usually a urinary tract infection that women are not aware of. In women with a urinary tract infection, it usually occurs once in a year. In recurrent cystitis, 55% of infections can eventually lead to upper urinary tract infections, and it can lead to the kidneys. Therefore, it can be a significant problem for some women. Recurrent kidney infections causes progressive damage and scarring, and in some cases, it can cause kidney failure. Treatment for kidney failure can be expensive because it requires lifelong dialysis and a kidney transplant. Urinary tract infections are much more common in women than in men, with the exception of newborns. Most cystitis is caused by bacteria. However, the patient's symptoms are not necessarily related to the amount of bacteria detected in the urine. Therefore, cystitis should not be diagnosed in cultured urine bacteria alone. Significant amounts of bacteria are detected in the urine of only 60% of women with typical urinary tract symptoms. And I'd like to now talk about diagnosis of cystitis. So cystitis is usually diagnosed based on symptoms, signs, and urinary tract findings. Microscopic examination of infected urine reveals high levels of white blood cells and bacteria. A urine culture reveals the amount and type of bacteria involved. When bacteria are detected, about 90% of cystitis patients appears to have E. coli infection. So let's talk about cystitis symptoms. Pain in the lower abdomen when urinating, and there is blood in the urine, back pain. Frequent urination, especially often at night. Urine is cloudy and smells bad. Stomach ache. Urine tests detect large numbers of bacteria and white blood cells. These symptoms may appear over a period of several hours to a day. Cystitis can also result from nerve damage. People with nerve damage, such as neurologic, bladder, or catheterization, may experience asymptomatic cystitis when symptoms of kidney infection or fever develop. So let's talk about causes of cystitis. Urine excreted by the kidneys is sterile until it reaches the urethra. In this state, it is transported from bladder to the entrance to the urethra. Bacteria travel through the urethra and reach the urinary tract, and in very rare cases, it can reach through the bloodstream. As mentioned above, women are more likely to get cystitis than men. First of all, in the woman's vagina, the distance between the anus and the perineum is short. Thus, intestinal bacteria can have much easier access, and infection through the urethra may be easier. Women have a shorter urethra than men. The short length of urethra makes it easy for bacteria to enter the bladder, and the defense mechanism can be weak. The body has several defense mechanisms. Urine tends to flush out bacteria as it flows. Also, the surface of the bladder has its own antibiotic effect. Let's talk about cystitis risk. Cystitis is a common disease among pregnant women. Sexual experience in a woman is associated with an increased risk of cystitis. When a bride urinates the next morning after the first day of the honeymoon, there is a case of frequent urination with pain. In this case, the bride sometimes gets upset because the groom did something bad and got to this state. Bad thing here means the groom has given the bride sexually transmitted disease. However, the above episode is more likely to be caused by simple cystitis, not a sexually transmitted disease. For this reason, it is strongly recommended that all women should empty their bladder after having urinated after sex. Studies have shown that the frequency of cystitis among nuns is 1/10 less than that of women who have had sex. In general, urinary tract infections in men are associated with anatomical abnormalities, prostate infections, and rectal intercourse. Homosexual men are more likely to develop cystitis through rectal intercourse. So let's talk about treatment recommendation. When you are facing with these symptoms, I strongly advise you to consult with your doctor first. Stimulation of urine flow and consumption of cranberry juice are also recommended for the treatment of symptoms for bladder infections. Urine flow stimulation. So to stimulate urine flow, increasing fluid intake is a must. Ideal liquids are pure water, herbal tea, and fresh fruits and vegetable juices diluted at least 1:1 in water. If you have cystitis, drink 2 liters of liquid from the mentioned liquid, but it must be mixed at least half of water. Carbonated drinks, concentrated fruit drinks, coffee, and alcohol should be avoided. I'm going to talk about cranberry juice. So cranberries and cranberry juice are known to be particularly effective in treating urinary tract infections. A study in the American Journal of Clinical Nutrition found that consuming 240 milliliters of cranberry juice daily reduced the symptoms of UTI by 40% in women with recurrent UTI. In another study, 80 ml of cranberry juice per day had a beneficial effect in 73% of patients with acute urinary tract infection. However, when cranberry juice was discontinued in the patients who did show an effect, bladder infection recurred in 61%. Many people think that the action of cranberry juice to acidify urine is also the antibacterial effect of hippuric acid, which is a component of cranberry. However, rather than the antibacterial effect of hippuric acid, it is necessary to focus on the acidification effect caused by ingestion of cranberry juice itself. You must consume at least 1 liter of cranberry juice to acidify your urine. Now let's talk about frequent urination. If you force yourself from not urinating, your urine will become concentrated. Concentrated urine can remain in the bladder and can cause infection. It is advised that urination is necessary before and after sexual intercourse. Let's talk about eliminating the cause of E. coli invasion from the beginning. When using a toilet tissue after defecation, wipe it from the urethra, the front part, to the anus, the back part. The most common causes of cystitis is E. coli. Therefore, when wiping from the front to the back, which will minimize the possibility of E. coli invasion. Let's talk about habits after sex. You should clean your genitals area thoroughly before and after sex. Also, urinating before and after sex can help prevent cystitis. Lastly, I'd like to talk about nutrition therapy. Vitamin A. Vitamin A plays an important role in mucosal health. In particular, it plays a role in preventing bacteria such as E. coli from infecting the urinary tract, bladder, and urethra mucosa. Vitamin C. Vitamin C has an excellent effect on acidifying urine. It is recommended to take 500 milligrams of vitamin C every 2 hours. Zinc. Zinc is a nutrient that helps maintain the health of the skin and mucous membranes. In addition, it helps to regenerate the cells and contributes to boost immunity. It is recommended to consume 30 milligrams of zinc per day. And lastly, lactobacillus. Women's diseases such as cystitis and vaginitis can be prevented by simply consuming enough lactic acid bacteria that are beneficial to the body, such as lactobacillus on a daily basis. So guys, I hope this video was very helpful for cystitis and its related diseases. If you like this video, please like this video and share this with others. And also, if you feel tired all the time, even if you are sleeping all day, and then try to do something else to get rid of the fatigue, but if you are not having any luck, I have got a free detox checklist for you to see if you need a detox so that you can get rid of the fatigue and feel better, so feel much energized. So thank you and see you next time.